Hi, everyone. I am here today with one of my patients who I've worked with previously. Today I just wanted to allow her to share her story with all of you, um, and so that you can hear from her own words what where she was, what she was able to accomplish, and what it was like to work with us here. And so I'll just be asking her some questions and allow her to just talk freely and tell her story. So Zareen, thank you so much for joining. I really, really appreciate it.
Yeah, you're welcome, Mark.
So why don't we just start real simply by just telling everyone a little bit about where you were before you reached out to work with me.
Okay, so we started, like me and my husband, we started trying for baby in 2012, around July, and after trying for air, I did not conceive. So I was back in India then. We approached a gynecologist and she wrote some very basic tests and everything was okay in terms of vitamins and basic blood count and things like that. So, and she did basic ultrasounds, basic ultrasounds, and everything was okay. Uterus is okay, ovaries are okay, my menstrual cycle was very timely, everything was great. So as such, she was not able to diagnose anything, and she said like just keep trying, give it some time more. So anyways, it didn't work. And back in India, like obviously when one thing didn't work, I moved to another doctor, and same story goes here. Like she did not was able to tell us anything.
Okay.
So now so I was the case of unexplained infertility.
Ah,
So yeah. So
unexplained.
obviously that, yeah, unexplained, because doctors were not able to tell anything why it's not happening. Like my husband's sperm count was okay, everything was okay from his end as well. So obviously this is a very frustrating moment when
Of
obviously
course.
you don't have like why it's not happening. Obviously I wanted to find a reason for it. Obviously there was a reason, but obviously doctors were not able to tell it.
Mm-hmm.
So I saw, like, around before approaching you, Mark, like I can say that I saw almost 8 to 9 doctors. 8 to 9.
I didn't know that. Really?
Yeah, 8 to 9. And that
Wow.
was enough to drive anybody crazy.
Yeah,
And
of course it would be.
obviously,
Yeah.
yeah. And it was very depressing. It was very depressing, right? And so when I came to US in 2014, we
Okay.
approached doctor here as well.
Mm-hmm.
Yeah. So after seeing like 4 to 5 doctors in India, I came in US, and here also same story goes. They did every testing from the scratch, and like they didn't find anything. They asked us like, yeah, we should go for IUI.
Mm.
So okay, so my gynecologist here in US, like she referred me to fertility clinic.
Mm-hmm.
So they started all the investigations, and so sitting in the fertility clinic is like, I read it somewhere, it's like kettles sitting in a row ready to be impregnated. So it's a very, I simply cannot put it in words. The moment I like, okay, today is my IUI, I was like, it's so stressful that I used to be in tears.
Yeah.
Whatever physical pain you are going through, it's one thing, but emotional pain as well. Like I can totally relate to the females, and I, like, nobody should go through the pain. So in 2015, I think back in August 2015,
Mm-hmm.
okay, it didn't work. Okay, so the doctor said, okay, it doesn't, it does, it's not necessary that it will happen in one go, so we should go for another. So in September or October 2000, no, I'm talking about 2015. Yes, in
Right. Yeah. Yeah.
2015 October, yeah, in October 2015, and that that second IUI was like failed. So at that point of time, I was like totally shattered. Shattered is the word. Like, and it was so, I was so disappointed. So me and my husband, we decided that obviously there is a reason for it. It's unexplained infertility, but we really like need to find the root cause of it, because having a baby is a very natural process. Like why it is it's why it is so hard for us.
Yeah.
So like I was googling, I started searching on the internet, and I started reading books on infertility, and I came across one book on Amazon, Yes, You Can Get Pregnant.
Mm-hmm.
And that's written by Amy Robb.
Right.
So that book was so motivational, and like I purchased that book. I made changes in my diet, by only reading that book.
Yeah.
So I started it, but it was not, I was trying to make changes actually.
Yeah.
So one day, like I got registered on a website. So one day, I think, remember, she invited you on some interview.
Yeah.
Yeah. So I was like totally impressed. Like this doctor, like he seems to be very knowledgeable, and I don't know how I was so convinced. Like you were answering questions like as if you know everything. So,
I don't know about that.
yeah, everything. You have answers to, like, females were asking questions. You have you have answer for everything, and you were listening very patiently. So I thought, like, after listening to that interview, I started googling your name. Then I was okay, who is he then? Then I obviously I approached you through your website, and I approached you. I remember back in January 2016.
That's what I thought. That's what I remember. Yeah.
Yeah, January 2016, and I started your treatment in February 2016.
Right.
And I got pregnant. I got my first positive pregnancy test in May 2016, and that was mind blowing.
I remember the email.
Because obviously I didn't believe my eyes, and yeah, so I just took the picture, and I just sent you the photograph of it. Can you please confirm with the blood test? I still cannot believe my eyes. So I mean, your treatment, I don't know, it was a magic wand or anything, I don't know, but it was awesome. It was great. And I cannot express my gratitude, Marc. Like, seriously, you are a God-sent blessing. That seriously.
Oh, that's very sweet.
Yeah.
That's very sweet.
I know. I don't know how I reached you, but it's a blessing. Like I met you, and I got treatment from you, and obviously this is. I'm beyond words. Thank you. Thank you for everything.
That's very sweet. So I know that everyone had told you previously, all the 8 or 9 doctors that you saw, which that was a surprise to me. I don't think I knew that. I know they told you things were unexplained, but when we started working together, I did find some things that were not unexplained.
Yeah. So
can you share in your own words for everyone to hear kind of how we went from unexplained to the diagnosis and then the pregnancy?
So you diagnosed that I had, like, I don't know the correct medical term of it. I think it's anteverted uterus. Oh, I have retroverted uterus.
Retroverted, yeah.
So I had retroverted uterus. That was one of the issue.
Mm-hmm.
And the second issue is that you diagnosed me with Hashimoto's.
Yeah.
Yeah. So obviously it's what do you call thyroid and antibodies.
Uh-huh.
And you told me that obviously my thyroid was in normal range, but antibodies was not, it was killing the embryos.
Mm-hmm.
So pregnancy was not happening. So obviously for Hashimoto's, you gave me a very, your supplements, your treatment, your, your gluten-free diet.
Yep.
And it was a rigorous diet plan which you gave me.
It was difficult for you, right? I remember you had some troubles with it, and it was not easy.
I was so overwhelmed, but obviously with your assurance, Like I was able to get through it. Yeah. But
Yeah,
I
no, and you did
obviously,
great following through, even though you weren't happy to do it. You did
I was
great following
unhappy to
through.
do it. Yeah. So I used to ask Mark, can I have, restaurant food once in a month, once in a week?
I remember.
Yeah, it was like, because changes in diet is a big step.
Yeah, it's difficult. It's
Yeah,
difficult.
yeah, it's
Yeah.
difficult. And for retroverted uterus, you asked us to, to change the position while you are, getting
Yeah, having
intimate.
intercourse. Yeah.
So yeah, so I think that two things really work. And obviously you really kept track on my antibodies, so that like regular follow-ups after week or 10 days. So
Yeah.
that really helped. And obviously your supplements, like, and other deficiencies, vitamin D
Right.
deficiency was there. And I think, I don't know, you gave me like K2 as well, lot of things. And yeah,
Yeah,
that's all I
I
remember.
think for everyone listening, the points that Zareen brings out, about her retroverted uterus and the thyroid are key points, things that were missed and
Yeah,
that weren't accounted for. But they also weren't the only thing we treated. We did treat some hormonal imbalances. We also treated
yeah,
some other underlying issues that
yeah.
needed
I
to
don't
be
know. My
corrected. And so we put all those
FSH, yeah.
together. Yeah. Yeah.
Yeah,
Yeah.
FSH and that ratio we used to talk
Talk
about,
about,
that
right.
was slightly mismatched. So yeah,
Yeah.
but like I'm amazed the doctors, like, they are either not aware of it, or I would say that the only, like, allopathic or what functional medicine has, it has different perspective of
Yeah.
looking into things. Yeah,
That's what I was going to say, is that it's
yeah,
not that they weren't aware, it's that they don't look as detailed as I do,
yeah,
as that,
yeah,
me and my team does. And they don't look for all the markers. So they're just looking at little things, because they're just looking
yeah,
at your body as your uterus, and they're just looking at these hormones, and they're not looking at everything
yeah.
else. And I'm just taking a broader approach with a more refined lab value range. Yeah.
Hmm.
And so
Yeah.
with
So
that,
for
we're able to put things together a little bit more specific for your needs.
Yeah, because I got ultrasound like at least 3 to 4 times, and
Hmm.
nobody pointed out that though it's written in the ultrasound report retroverted uterus, but in their terms, it's normal. It's not.
Right. It's not a big
Yeah,
deal. Yeah.
it's not a big deal. Yeah.
Yeah. And so that everybody else knows as well, we didn't just stop once you got pregnant, right? We worked together
Yeah.
into your pregnancy, at
Yeah.
least into your
Yeah.
first
Yeah.
trimester. Yeah.
No, you were there in second trimester. You ordered
Yeah.
some blood tests for me.
Yeah.
You were you are like very prompt response to my emails, my, and obviously where you used to, during our consultation calls as well, I used to ask a lot of stupid questions.
No, no.
No, yeah. And you were very patient, and and very prompt response to my emails. And you obviously, I was bit, um, during pregnancy also, you ordered antibodies tests for me.
Yeah.
Yeah, so that I just wanted to keep a track on it, so that it's not affecting the baby.
Sure.
So
Sure.
during, yeah, I think we got it done during 6 month, or yeah, during the mid pregnancy we got
I
it
think
done.
so. I think so. That
Yeah,
sounds about right. Yeah, I mean, for me, it's not enough that patients just get pregnant. I want to make sure that you hold the
yeah,
pregnancy and you carry to full term. So that
yeah.
was
And
that
that's
was
what you used
big.
to say, that your goal is to have, to have a healthy baby. That's the mission. Yeah.
Yeah.
So that's what I said, that you were like, you were a godsend. And Mark, like, yeah, obviously I like, and there are some of my friends who are like having fertility issues. Like I've given you a reference, because I know, like, if you're like, I was very late in approaching you. I went through a lot of, lot of
Right.
stress. I wish I would have found you earlier. And I like, you were a godsend. That's
It's very sweet.
yeah, Mark. And like, obviously, and I would like, thank you for all the, support during the tough time of when I was not able to conceive during pregnancy. And thank you for everything.
Oh,
Uh,
it's my pleasure. Thank you. Thank you
yeah.
for trusting in me to help you. I appreciate that.
I don't
You
know.
gave
Yeah,
me
I
the
like the
opportunity.
yeah, like, because of your constant reassurance, because of your, patiently listening to my questions and like going to the depth of the issue, like what exactly is the problem. I don't know, like I have confidence in you from day one. When I had the free consultation, like I got, you know very good vibes. Okay, I think he's the one who can help me.
Oh, that's very sweet.
Yeah.
Any last minute words or things that you want to say to everyone who's watching? And there doesn't have to be, but I just want to give you an opportunity if there is.
I would say, like, I wish everyone the very best. Like whoever is having fertility, you should know nobody should go through. I wish nobody should go through it. And if you're having, unfortunately, I think Mark is the one whom you need to approach. Seriously, it's worth every penny. Your treatment is worth every penny. I mean it.
Oh, thank you. That's very sweet.
Yeah.
Yeah, that's very
Yeah,
sweet.
well, once you hold the baby in your arms, you will forget everything. That's what I told you. See, after delivery, I don't remember most of the things.
That's not uncommon. You know what I want to
So,
encourage everybody to understand, the biggest thing I think from your story is that you went to so many people and everyone was just looking very superficially.
exactly,
And for most of us, we're all unique, we're all individuals, and we need to have somebody look at us as an individual and look deeper to find the answers. And just like you said when you started, it's something that I often think about, is like we should be able to conceive on our own. That's what we were made to
exactly,
do. So if it's
exactly.
not happening, why isn't that happening, and how do we figure out what that is, and then from there we can fix it. So, and that's really
Yeah,
what we did with you.
yeah. That's what I said. Having a baby is a very natural process. I don't know why it's not happening. Obviously, there is some deeper issue which was not addressed.
Yeah.
Yeah,
Well,
and I read your book, The Secret of Conception, as well, along with your treatment.
oh, yes, yes, yes. It was good.
Yeah. Yeah.
Well, I'm glad. Well, thank you
Yeah.
so much for your time, for
You're welcome.
sharing your experience and your journey and so forth with everybody watching. Hopefully, it was beneficial for all of you listening. Again, thank you so much for your time, Zareen. I really, really appreciate it, and hopefully everybody else does as well.
You're welcome, Mark, and thank you for everything.
Yeah,
I
my pleasure.
appreciate it. Yeah. Okay.